Hi, everyone. Welcome to another snippet on what pharmacists do. Today is a fun one, a really special one, because we're going to talk about what pharmacists do in jail, in prison. So, to do that, I have with me my friend and colleague, Dr. Bernice Perez. Bernice is a graduate of Touro University, California, class of 2015, and my coworker at Contra Costa Health Services. Welcome, Bernice.
Thank you. Thank you so much for having me and inviting me.
You're welcome. I'm so happy to have you here. Thank you for taking your precious time off today to share with us what you do as a pharmacist. And FYI, guys, Bernice looks so good. She just had a baby boy and she just got back to work after a little time off. So she's a rock star. Congratulations. How's Levi doing?
He's good. Yeah.
Good.
Yep.
Is he walking
Getting
yet?
used to being a boy mom like yourself.
Oh, yeah. Twice a boy mom. And I asked if he's walking yet. I was just kidding because he's not even 6 months old yet, right? No, he's almost
he will be 8 months on Monday.
Yeah. Anyway, Bernice is here. And before we dive into what you do in jail, can you tell us what you like best about being a pharmacist?
So I did give this some thought, and I'm not sure if it'll make that much sense, but I kind of like how I basically feel like I'm the glue in a patient's care, like team setting. So, when the glue kind of reaches like all the different aspects, so we kind of sometimes interact with the doctors, sometimes with the nurses, basically whatever it is that, at least for me, the way I see my job, whatever it is that needs to get done to provide more stable support to help the patient. And then sometimes it's also just talking directly to the patient.
I like that. I hadn't thought about it before because a glue kind of connects, patches things together, right? And so many things can slip in the patient care process. The doctors can miss something, the nurses can miss something, or there are questions to be answered. And we work in so many different settings, and we take such a close look at the patient's chart that we are very most likely, I would say, to catch things that are missing, direct patients in appropriate or necessary services and things like that. So being the glue in the different steps of the healthcare process for patients,
right,
is an amazing way to look at it. I had never thought about it that way.
Yeah. I mean, and a lot of people, when they think about healthcare, we're kind of like in the background, sort of. So it's not like we're not in the spotlight all the time. So that's like another.
Just like the glue, you can't see the glue, but without the glue, everything falls apart, right? That's a great way to look at it. All right, nice. I think I'm gonna keep that and use that a lot now.
Oh yeah.
So amazing. We are the glue in the healthcare system. It's a great way to look at it. Anyway, I've said that like 10,000 times now. But let's dive into why you're here. Bernice is a pharmacist at the Martinez Detention Facility, which is, of course, a fancy way of saying jail. And she works there a lot as part of her duties at our job. So Bernice, can you tell us what your role is as a pharmacist in jail?
So in jail, and this is mainly specifically to my job, because I have run across other pharmacists who've worked like in other jail settings. And so it's not exactly the same everywhere.
So you're going to talk about what you do. And
yeah.
give
So
us an
specifically for the in Martinez, it's similar to community retail setting in that we are verifying a lot of prescriptions for patients who happen to be the inmates, but we are more in contact with the doctors and nurses. So
got it.
We work in pretty much the same room as them. And we're able to, if we have any questions or anything, just talk to them directly. And I mean, I guess one of the things that's different than retail, we don't have to deal with insurance.
Yeah.
So it's mainly about, in terms of the prescriptions, it's mainly about making sure that they get to the nurses in time for when they're started. And then I guess one unique thing that pharmacists and healthcare professionals who work in a jail setting need to think about is, I guess, like safety a lot in terms of certain medications or certain packaging can't actually be dispensed to the inmates because then they could be like used as a weapon or something.
For example.
So, for example, one of the, I guess, most interesting, creative, I think, things that I've heard was the inmates have taken fiber capsules. So like it's a powder, it comes inside a capsule.
Like the Metamucil capsules?
Yeah. So if they are given enough of those, they can take out the powder and wet it, and it becomes something that they could mold.
Oh my God. Oh, okay.
Yeah. So things that you would not really even think about.
Okay. Yeah. And are you dispensing? So the doctors, the providers put in the orders for the inmates, and you verify the orders for safety and appropriateness and efficacy and all that, and they are given to the nurses to administer to the inmates. Or do the inmates come to the pharmacy to pick up their orders?
It's the nurses will come down to the pharmacy, and we'll give them the medication. So the nurses are the ones who are giving it to the patients.
Okay. Do you feel safe working at the detention facility?
I do. There is whenever there's an inmate or any patient walking in, they're always escorted by an officer.
Okay.
And the pharmacy or the med room itself is like in a kind of locked door. So my personal interaction with the inmates is pretty minimal. At least in this setting. Yeah.
Got it. All right. Is there anything else you want to add about your role there?
It's definitely given me a lot of different perspectives, I guess, like things to just see. I mean, because inmates sometimes are like walking or like crossing our paths. There's a servery area, kind of like a cafeteria area, and the food there is prepared by inmates. So we sometimes have like small conversation with them, but we do get training in terms of not to really fraternize with them, or things that not to say or do. But yeah, it's definitely an interesting experience, and still I guess just I mean I enjoy working with like a sort of a different population, and trying to also make sure that they still get the care that they deserve.
Yeah, and deserve. Yeah.
Mm-hmm.
Awesome. Thank you, Bernice, for coming on and sharing that with us.
Yes, of course.
But before we leave, I would like to ask you if you have any piece of advice for people out there thinking or wondering about a career in pharmacy and how to get started and be successful in it.
I guess one of my pieces of advice would be just to have an open mind. And I think that a strength as a pharmacist would be like their ability to think creatively. So, even though I know it's a lot of science and math and things like that, which is also important, but when it comes to like using a clinical judgment, or even getting satisfaction in your job, I think that sort of finding a way to think outside of the box and see what it is that you can provide for a patient or another healthcare professional. Just that mindset is good to have.
I agree. Thinking outside the box. And you just mentioned as your role at the detention facility, you're not only looking at the drugs and their efficacy and whatnot, but also now the inmate safety, right? In terms of what kind of dosage forms or certain drugs that should be administered to a patient, like a fiber capsule possibly being used to create other unintended things. And I think this is the kind of thinking that pharmacists should have, and that would make someone successful in their career path as a pharmacist.
Definitely.
Great advice. Thank you so much, Bernice, for coming on and sharing your passion for pharmacy and your role as a pharmacist in a very unique pharmacy setting.
Oh, thank you, Brigitte, for having me. And thank you so much for all that you do.
My pleasure. We just love this, right? And we just want to spread the word because we love what we do. If you have any questions for Bernice about what she does, about her career in pharmacy, reach out to me on my webpage, therookiePharmacist.com, or on my Instagram page at @therookiePharmacist, and I will definitely help you get in touch with Bernice. Until then, God bless you. Have a wonderful rest of your week.